Facelifts are a hot topic. A lot of ladies and men, of course, come to me asking about facelifts. And I think for the lay person, it is quite difficult to decide and ascertain where they should go for a facelift. Now, I think the bottom line is for most people, what they're unhappy about is some sagging of the skin around the face, particularly the neck, the jawline, and they also feel that the skin's lost elasticity, which obviously makes things worse as well. And generally, it makes them look a little bit tired and a little bit aged. So in those situations, patients seek to have a facelift. Now, a lot of these patients have actually done a lot of non-surgical treatments beforehand, before they've actually come to the point to ask a facelift. Because let's face it, nobody wants to automatically be subject to the knife if they can avoid it. So they understandably try to seek alternative treatments, things that don't require a scalpel, things like needles and syringes or energy devices, lasers. All these things have a place in sort of restoring or rejuvenating the face. And it's understandable that patients to seek these out, and I think that is the proper way you should take things. In other words, you find the early signs of aging, you shouldn't automatically go for a facelift. So you should see what can be done through non-surgical, less extreme routes. But after a certain point, everybody will probably require a facelift, because those treatments like needles, fillers, Botox, although they work, they'll improve things up to a point. Afterwards, you can't stop the ravages of time, and so people will require a facelift. Now, it's a bit of a scary proposition for a lot of people to have a facelift, because let's face it, the moment you talk about a facelift, a lot of patients automatically perhaps think of the bad facelifts that they've seen, and most people have seen bad facelifts. And it's understandable people want to avoid that look, okay? I mean, I can't recall anybody coming to me telling me, you know what, give me a pulled look, give me one that obviously clearly looks like a facelift. I had a facelift. Most people want a natural look. They want an improvement, but they don't want it to look windswept, okay, or extreme. And that, of course, is understandable. But at the same time, one mustn't try to shortchange themselves by saying, I just want just a little bit of a facelift. Because, my experience is if you have just a tiny little bit of a pull, the surgeon might give you a small little effect. The problem is 6 months down the line, a year down the line, that small effect will have diminished because it will loosen again and relax. And then you're back to square one. And then you're unhappy why you even had the facelift in the first place. So you want to find the right golden line where you get a great effect, okay? But at the same time, it's not extreme. And that's pretty hard for people to know, where to go. Because let's face it, a lot of surgeons, we all say, yeah, we give a great result, we give a natural result, but that's not, we can't all be right. Because let's face it, the expertise is quite varied between surgeons. And it's pretty hard for the lay public to try to ascertain the nuances that determine the difference between an okay facelift and a great facelift. Things like positioning of the scars, how the skin is stitched, what work underneath the skin, i.e. the muscle repair has been done, to what effect has been done, has it been satisfactorily, the post-operative recovery. There are many aspects that people need to understand. And so it's not always easy for people to determine. So one way, obviously, you need to go visit a surgeon and have a consultation, and don't consider it as being told what can be done, because I think you should be armed with questions yourself to ask the surgeon to see, for example, how many he does or she does. Look at examples of the work, because that's really important. If a surgeon does a lot of facelift, he should have a lot of photographs to be able to show you, not just one or two cases. If you usually just see the surgeon showing you a couple of cases, well, you have to question and ask yourself, do they do a lot of these things? And you really want to go somewhere where they actually perform a lot of surgery, because like anything in life, if you perform a lot of something, you can become good at it.